Hello, and welcome to the Contagion News Network. I'm Assistant Editor Grant Gallagher, here with the week's top stories in infectious diseases. A new study suggests connections between widespread mental health challenges and the decline in care during COVID-19. While fear of the virus is also a factor, according to a recent study published by investigators in the Journal of General Internal Medicine, pervasive anxiety and depression during the COVID-19 pandemic has contributed to nationwide underutilization of emergency care. According to results drawn from a weekly survey, individuals who experienced symptoms of anxiety and depression had higher relative risk for delayed medical care and for not receiving necessary non-COVID medical care after adjustment for potential confounders. Emergency health care use has declined by 10% for hyperglycemic crisis, 20% for strokes, and 23% for heart attacks so far. Ambulatory visits have also declined by almost 60%. While it's beyond the purview of the study what interventions need to be changed and how to improve mental health crises in the United States, it is empirically observable that delays in care are in some sense linked to a demoralized social populace. A trial of remdesivir for moderate COVID-19 has shown modest positive results along with some uncertainties. Odds of better clinical status were, however, higher for patients with moderate COVID-19 who received a 5-day course of remdesivir than for those receiving standard care, according to the most recent randomized clinical trial of the antiviral drug. For more on these stories and the latest infectious disease news, go to contagionlive.com. Now, on to an interview with Rinki Varandani Desai. Desai shares her speech pathology perspective on how COVID-19 has impacted her work in patients. Speech pathologists are essential to recovery from the virus for people who had severe cases and are placed on ventilators.